There's that big old nose. This week we're putting Obamacare jobs to the smell test, and the government, that's pretty smelly, I got to tell you, because the government wants to make it easy for Americans to sign up for Obamacare. Isn't that nice? So they opened a call center, a bunch of them, but they've got one out in California they opened to help explain the new health care system to the people who want to sign up. Ironically, the call center is using part-time employees so they don't have to provide them with the health care coverage that they're helping other people get. Is this just another example of why Obamacare is really just a bad idea? Joining me now is the author of Beating Obamacare, Your Handbook for the New Health Care Law, Betsy McCoy. This is like the craziest story ever. They had, first of all, about the jobs market. 7,000 people showed up for 200 jobs.
That's right. And they thought they were going to be full-time jobs.
Yes.
And then the rude awakening, they're going to be part-time jobs.
Yes.
The hypocrisy of all this. Here is a law, and here it is, right here, compelling employers with 50 or more full-time workers to provide health coverage, right? It's good enough for every employer except the employer Obamacare itself. So there you have it. But we're already seeing the terrible impact of this requirement on Americans who are job seekers or who already have a job, because employers are pushing down their workforce to part-time status to avoid having to comply with this law.
You know what the answer is to that? The retort is always businesses will hire if the demand from their customers for their products or services is high enough. I'm going to have to hire more employees.
Well, no, look at the June federal jobs report. It showed 93,000 part-time jobs created, only 22,000 full-time jobs. That's the reverse of what's normal.
That's not just June. That's been going on now for quite a few months.
Oh, yes, but it shows that Americans are now having to cobble together a living to support themselves and their family with 2 or 3 part-time jobs instead of 1 full-time job with benefits.
All right.
And by the way, let me just point out, it's not just greedy corporations doing this, and it's not just the Obamacare call centers. It's governments at every level, county governments, school districts, community colleges.
Detroit, the buzz is that's one of their bankruptcy problem is to take all the employees of Detroit and the retirees and say, see ya, you're off our system.
Well, the state of Virginia is pushing many of its workers down to part-time status to avoid providing health benefits. So you see it going everywhere. And this delay that was announced recently, this 1-year delay in the employer mandate, it's not a reprieve. It's more like a whiplash because businesses plan way ahead. And so a 1-year change isn't going to be... It's too late for them.
Yeah, but you were saying just before we started that the whole point behind the postponement wasn't because they're not ready.
Oh, no.
You're saying there's a hidden agenda here.
That's right. Several weeks ago, Kathleen Sebelius, Secretary of Health and Human Services, went to the NFL, the NBA, saying, please encourage young, working-age, healthy people to sign up for the exchanges, because if they don't, premiums are going to spike higher than they already have. We need young people who don't need much health care but will pay premiums to offset the cost of caring for the sick people who are inevitably going to be in these exchanges.
Right.
So when the NFL and the NBA said no, just a few days later, the administration decided to delay the employer mandate. And what that will do is push millions of workers who thought they were going to get coverage, right? People who aren't currently insured at the workplace but would be under the mandate. It's going to force them to go into the insurance exchanges.
So the young person is thinking, all I have to do is wait until January and I will finally have health insurance.
And now that person won't. But what it's doing also is delaying the employer mandate is shifting an enormous cost from employers, you guessed it, to Joe taxpayer. Because now the taxpayers will be supporting these subsidies on the exchanges. The Congressional Budget Office came out...
What did CBO say?
The Congressional Budget Office came out with an estimate 2 days ago that it would add $12 billion to the cost of Obamacare next year. That's $12 billion out of taxpayers' pockets.
By making this postponement.
That's very inaccurate. It's several times that because the CBO failed to take into account the cost of the employees' dependents and also the cost of employees who haven't had insurance in the past and would have gotten it but now are going to the exchanges. So it's going to be a big ticket item and it's going to be cash right out of your pocket.
You know, I get the idea about the fact we do have evidence, and law, even though Jay Carney says no, but there's a long list of companies that are shifting to part-time people for the purpose of getting under that 30-hour requirement. But the other boogeyman in this Obamacare story is how many of the companies that are currently covering their employees are going to say, I'll pay the penalty, it'll cost me less, and dump health insurance. And a lot of people watching this right now are going to lose their health insurance. And to your point, if that's true, it saves the companies money, but it costs the taxpayers.
That's right. So I would say this is not a victimless crime. Clearly, the president didn't have the authority all by himself to postpone the employer mandate. The law says it starts January 1st. He is not Congress. He is just the president, so he doesn't have the constitutional authority to do it. But this is not a victimless crime because it's actually shifting enormous costs onto taxpayers, and nobody's talking about that. This is a crime against taxpayers.
You would think the anti-corporate big government or big corporate people that are anti, the Wall Street crowd and everything else would be jumping up and down about this, but nobody's saying anything. The shift is underway.
That's right.
Yeah. Betsy McCoy, thank you for bringing this up.